Hi, everyone. My name is Jill Hasselman. I am the SVP of Strategic Partnerships with HR for Health. Welcome to an episode of our DSO Conversation series. I'm so excited to have Dr. Bryan Laskin on our conversation with us today. I was thinking about the first time I met Bryan was probably 8 years ago, maybe 8 or 9 years ago. And at the time, we met at the ADOM conference. And I remember just being so impressed with how much you were able to just keep in your brain and all the ideas that you had and everything you were juggling. And so it's really cool to see like your journey over the years since then. And so I'm super excited to be able to have this conversation. So welcome, Bryan.
Well, thank you very much. One of my, like you said, early sort of vendor friends in dentistry,
Yeah.
and just have always been impressed with your infectious, positive personality
Oh,
and what
thank
you
you.
bring to the industry. So thanks, Jill.
Thank you. Well, yeah, and as kind of a kickoff, I mean, because you have so much really in your Rolodex that you've done, do you want to tell our audience a little bit about like the last 10 years and kind of what you've been doing and where you're focusing now? Maybe the last
Sure.
5 years.
Sure. Well, it's funny. It's funny you mentioned that because I actually just went back to the University of Minnesota Dental School yesterday for the first time in decades, because they're looking at implementing some of the things that we're doing. And I saw one of my instructors from dental school, and I was like,
Oh.
it's been 24 years since we've met. So he's like, what you been up to? And I was like, that's good.
Where do
We're
I
going to
start?
be, yeah, where do I start? So here's how I would answer your question. And thanks for the context. I am a dentist. I practiced dentistry for over 20 years. I don't see patients regularly anymore, but I grew my practices, sold them a few years ago to the fourth largest DSO at the time, where I served as chief innovation officer for a few years. But along the way, I've started developing technologies, and the biggest which is probably where we met. I was talking about Opera DDS, which
Yeah.
is a patient engagement solution that we scaled to over 26,000 dental practices. I sold that 2 years ago to Vine Dental, and all of this is to say that I have had some insights into the industry that the average dentist doesn't get to see through scaling software companies and being part of a large DSO. And when I sold Opera, I mean, I've already really kind of retired twice. I sold my practices. I sold Opera for a phenomenal journey with that platform. And I sat back, and I'm not one to like hit a golf ball and then walk in and hit it again. So I didn't want to retire. And I thought, what's the biggest problem given my sort of relatively rare involvement in different areas from standardization and education and innovation and in the industry that I can solve. And probably took me 10 seconds to think about it because there's been a problem. Opera DDS basically helped me solve problems in my dental practices through communication. Toothapps, the platform that we've just launched, is really about solving problems that I met through Opera DDS. And what that problem basically is, it's what I believe to be the biggest barrier to innovation in dentistry, also the biggest blockage to having us elevate patient care, the clinical delivery of care, and also the biggest blockage to having higher revenue in our practices. And what that is the lack of data accessibility, interoperability in dentistry. A lot of the software act like the data inside that software contained in their databases, whether in the cloud or on premise or on a device, they act like it's their data. Fundamentally, this data, if it's part of the electronic dental record, is legally owned by patients, legally owned by dentists, and we need access to that data, whether you're a software vendor that is trying to do something innovative, whether you're a dentist trying to provide quality of care, whether you're a DSO and you're trying to look for ways to improve by tracking success clinically. If we don't have access to this information, it's like trying to practice dentistry with one hand tied behind your back, right? And that's the way we've had to deal with it for so long in dentistry, and there's so many cascading negative consequences that the average person doesn't even think about
Right.
because it's always been that way, right?
Yeah.
So that's what we're solving at Toothapps is we're opening up what I call the data prisons in dentistry and allowing people to leverage their data, not the software company's data, the practice's data, the patient's data. Ultimately, this is the patient's, let's be honest, right? And so that we can elevate care, increase innovation, unlock what I believe is going to be the biggest wave of innovation and higher quality of care and more revenue for DSOs.
Yeah, it is such a pain point. I mean, even with our HR for Health platform, we are constantly having to remind our clients, like, this is your information about your employees. Like we get the question asked all the time, like, what if I need to pull things off of the software? It's like, yes, absolutely. That's the point. We're not employing the employees, you are. And so you have to be able to do that. And so just even in our niche of HR, we're constantly having to innovate our software to make sure that our clients are able to do that. And so a solution like this only makes that better for all of the companies like ourselves. So yeah, I'm really excited to get into it today. What we want to talk about is, and Bryan is the expert in this, so I'm going to let him do his thing. But to kind of tee it up, we want to talk about, and I don't even know if some of our listeners are aware of this, but the 21st Century Cures Act, and what that means. How is that pushing change or forcing change in the dental industry? How can we immediately apply this new legislation to cut costs and make our organizations profitable? All of those things that Bryan was talking about. So I think a great place to start, Bryan, is what is the 21st Century Cures Act and why should we care about it?
Well, great question. And if you haven't heard of the Cures Act, to the audience, in dentistry, you are not alone. This has not been publicized in our industry yet, but it will be because it's written by the same people that wrote HIPAA, which is HIPAA, if you're unaware, is about privacy and security, keeping our patients' health information safe, private and secure, and obviously of vital importance. However, a lot of dentists kind of, don't enjoy HIPAA because it makes our workflow more difficult, right? Privacy and security, let's face it, it slows things down. It's vitally important, but it slows things down.
Yeah.
The Cures Act is almost like the reaction to HIPAA to allow people to have data accessibility. So while we do need to keep people's information private and secure, the Cures Act is about having a patient have access to their data. So like when you mentioned HR for Health and all the great things you do and having to open up the team's information to people, that's not the Cures Act, right? The Cures Act is about patient health information, what's in the electronic dental record. And there's fines if somebody blocks information from a personal health information data, like if a software vendor says no, you or the patient or a software vendor cannot have access to this data, each incident has a fine of up to $1 million.
Wow.
So the ONC, the HHS are very, very focused on this. And there's massive fines, which basically is just looking to ensure that people do what is morally, ethically, and now legally imperative, which is having the access to data. Yeah. And like when I mentioned that, HIPAA is about privacy and security, that makes everything more challenging because we have to have multi-factorial authentication and, single logins and audit trails, which are all great, but it makes it more difficult. If you think about it, the Cures Act makes everything easier, more frictionless, because we have this access to data so we can do what we need to do. And so HIPAA is important and under leveraged or under, I would say,
appreciated
in dentistry, right? But the Cures Act is I think going to be adopted much quicker because let's face it, it makes everything easier, right? So that's what the 21st Century Cures Act, obviously it's a relatively large regulation, but if I'm going to summarize it, it's really about data accessibility, how patients have access to their data, how clinicians have access to data, how anybody who's a healthcare stakeholder gets the information that they need to provide the highest of quality care.
And what sort of, like, how deep does that data have to go? Like, what are the instances that the patients need to have access to?
Oh, great question. That's a very, very great question that I would say, I'm one of the people that's on the forefront of answering that question.
Yeah.
So ultimately, it's the electronic dental record, right? And there's a little bit, there's a little bit more to it than that, but let's just talk about the electronic dental record for a second. And if you allow me, I'll ask you questions now, just to because it's important, because these questions I've asked the people at the highest level of the profession, and they don't have great answers.
Yeah.
Right. So I will ask you these questions, not to put you on the spot, but because I would like the people listening, watching today, to sort of think of answers themselves. Right.
Yeah.
So I'm going to start off by asking you, when you think of just name a software platform. When I say electronic dental record, what first that pops in your mind?
Dentrix.
Just Dentrix. That's probably I would say what most people would think of, because it's the largest practice management software.
Yeah.
Right. So Dentrix doesn't say they're an electronic dental record. They say they're a practice management software, or PMS.
Well, that's actually what went through my head when I said Dentrix. Well, they're practice management software. Is that the same?
Well, you're probably thinking more than the average person, right? So I like this game we're playing. So let me ask you this: what's a practice management system?
It is a system that houses the information for patient, like, scheduling and treatment that they are receiving or need to receive.
Okay. I think that's probably as good as the an answer of the people that I know that run these systems, right? So it's a good answer. It's not right.
Not right, but good.
I don't think so, because it does more than that, right? It does less than that. It's what I would say. My definition is, and this will make you feel better. It's a bunch of features that somebody slapped together, probably in the early 90s, and said, well, we went from a paper chart to a digital chart, and we added some stuff. So what the hell do we call this thing? We call it practice management software, right? Okay. So let's first define what an electronic dental record is not, which is Dentrix, which are the practice management software, right? I'm not picking on Dentrix necessarily. It's just the one that you mentioned, which I think most people would, because it's the largest, right? So it's not the practice management software. So let me ask you the next question, which I wouldn't expect you to know. I wouldn't expect our listeners to know, but I would expect the people who run the practice management softwares to know, and nobody knows, right? I've had nobody answer this question correctly.
Okay, so I'm already
Jill,
set up for failure.
I'm spraying honey all over you and sending you out to the bears, right? So what is an electronic dental record?
I don't know.
Well, good answer. The electronic dental record is defined in ADA standard 1084. So there's actually a standard that the American Dental Association wrote. It's a little bit old, called 1084. And right now I'm one of the co-chairs of the work group that's redefining what 1084 is. And so what we're doing is we're defining the elements that actually fall under the umbrella of electronic dental record, which would be covered by the Cures Act. Okay. So let me ask you a couple questions about the electronic dental record. Would the dental history be part of the electronic dental record?
The dental
just
history.
Guess. I mean,
yes.
I would guess so. Yes, too. And, I think my opinion is important, because I'm going to be one of the authors of this thing. So,
I was going to say, I guess you get to decide, right, what the answer to that question is.
I'm asking your opinion now.
Yeah, not I would say yes.
Right? Yeah, I would agree with you, right? What about X-rays? Would X-rays be part of the dental record, the electronic dental record?
I would think yes.
I would think so too. And guess what? Aforementioned practice management system that you mentioned, including the vast majority of of patient management systems, do not house the radiographs. So right there, it's different. How about, let's get a little more complicated. What about CAD CAM scan when you do a crown on a patient? Is that part of the electronic dental record?
I would think yes, but I'm already seeing your logic. That's a different system too.
That's a different system altogether. And how do you get access to that data? I totally agree with you. I would say that yes, that is part of the electronic dental record. If I'm a dental patient and I'm going and I move across town and I have a problem with my crown, wouldn't you want to have access to that scan for that patient, for that dentist to evaluate the prep, the material that was done? Absolutely, I would say yes, right?
Yeah.
But then we get into more gray areas. Is there's a lot of great AI companies now doing diagnostics and other things. Is that part of the dental record, right? And these questions are going to keep coming. So my point is that there's many different systems, not just a practice management software, that house all of these different elements that are part of the electronic dental record that fundamentally our patients have a right, morally, ethically, and very much legally now, to have access to this information, as do our dentists, as do our DSOs, anybody who's a stakeholder, right? And so it's vitally important, in my opinion, to bring all of these elements into a consolidated form and mindfully give access to patients, relatively complete access to the people who are delivering care. So that's why I say this is going to be the biggest wave of innovation, of higher quality care that I've experienced in my lifetime. Think about that new patient that just came to your office and you got their records from the last office. What did you get?
Right.
Jack squat is the answer, right?
Yeah. You have to start all over.
Yep. By the end of this year, the patient will be able to answer a few questions and send their entire electronic dental record to you as a dentist, so that you'll be able to look and see, why is that endo failing? Let's look at the history of that tooth for the first time, right? That's what we're doing.
And I would assume that, I mean, from the HR perspective, we see this happen all the time where new laws pass and they're vague of the wording that is used. And there's kind of two options. We sit there and we interpret the law and, advise and make our decisions in the safest way possible, always erring on the side of caution. But what usually happens is lawsuits are what then shape those laws, because there's the case law that's referred back to of how that law was interpreted. And then at the same time, we see these laws being amended because they realized the first time they wrote it, it didn't necessarily make sense, or they didn't think about this point or this point. And so I have to assume that on this side, especially with how quickly technology is evolving in comparison with these acts that are passed, that there's going to be really quick movement on how it's interpreted, what they need to be doing, and the software is really an only way that they're going to be able to keep up on it.
Yeah, I'd like to think that, we've learned that this problem is not new. I'd like to mention that, like, the problem of lack of data accessibility, of interoperability of information has been worked on. It's the primary issue that's been worked on the medical side for the last 20 years.
Yeah.
And so it's only new to dentistry.
Yep.
Primarily because of ignorance and by archaic business systems that don't want to change because they don't have incentive to.
Right. I was just thinking that.
So this is not a new issue. It's just new to dentistry. And so what we're doing at Toothapps, what I'm doing with the work that we're doing at the American Dental Association and through Dental Standards Institute, is laying the groundwork to actually be able to solve this problem. And one of the nice things is that nobody's done anything. I mean, and that leaves it so that we can actually come in and create a technology structure and a groundwork by standardization, such that we can hopefully holistically address the problems that you brought up.
Yeah.
There's problems on the medical side that we don't have in dentistry. And my goal with this is to avoid what has happened sometimes in the past, where we take a medical solution and bring it over to dentistry, and we don't look to see what could we improve before we bring it over, right?
Yeah.
And there's definitely an opportunity here. I think we have the right team. The other thing that's new is that not too often that I'm aware of in dentistry are the people who are creating the standards also creating the solution, right?
Mm-hmm.
And our goal at Toothapps is to look. We have a bunch of applications. You know me, Jill. We can't stop helping make cool stuff that we think is cool.
Yep.
However, we are a totally open platform. We want every platform in dentistry to be able to plug in. Doesn't matter if it's a completely open system. So if you have applications that you love using, the goal here is to plug them into Toothapps and just have everything work better, right?
Yeah.
And so we are kind of like an agnostic system that allows the passage of information. And we have some applications kind of like Google or Apple where you get them for free to help leverage this data so that you can,
Mm-hmm.
for the first time, for example, we have a fully integrated calendar, right? Nobody else in dentistry allows you to see your Apple calendar next to your EagleSoft calendar, next to your Monday.com calendar, and say you have a recall system, that calendar can come in all in a mobile-friendly, secure view that's HIPAA compliant, right? Where if you're the CFO at a DSO, all the personal health information is blurred out, so you can't even see it, right? But it's still, you have all the KPIs that you want to see. You can look and see what's going on in the organization. You just don't have access to the personal health information because it's not medically necessary for you. I went through
Mm-hmm.
that fast, but my point is that you're right. Regulation tends to be vague. However, the Cures Act, just like HIPAA, is not. It's not. Sometimes regulations pass and go, and people ignore them, and it's okay, right? The Cures Act is not one of those
Yeah.
legislations, right?
Yeah.
This is up to $1 million fines per incident. If somebody says, no, you can't have access to that data, that can be a fine of up to $1 million. If
Mm-hmm.
patients are requesting the records today in dentistry, there's fines that are being levied now between $10,000 and $80,000 per patient because they say they can't get their dental records quickly enough and they're not complete.
Yeah.
Well, today in dentistry, there's not a dentist that can give a quick, complete dental record to the patient, right? So we'll have that solution by the end of the year, so patients can have access to all of their data, so dentists can give access to the electronic dental record to the patient. I'm going on this a while, but I think you brought up a really broad question about regulation that everybody's
Yeah, I
thinking
was just
about.
gonna ask, like,
Yeah.
what are the exact like requirements that they need to be complying with, like, because again, I think that this is going to be news for a lot of people listening. So, like, when do they have to do this by, and what do they actually have to do?
Yeah, there are details. I believe it's within 30 days. You have to give a patient their dental record, their electronic
Got it.
dental record, which that is under ADA 1084, basically, right? Which we're revising right now. So yeah, I mean that's ultimately what I would say. And also, if somebody requests your information, don't withhold it. I wouldn't charge for it today. I think that you can charge. However, it gets a little murky. Like you said, regulation sometimes can be gray, and I would much rather not charge for dental records than to have a judge determine if I charged a reasonable amount, right?
Right.
Which
Yep.
was what would happen. And so there are what we don't have at Toothapps is all of the answers right now. I think we're developing a lot of this. We've developed a lot of it already. The interoperability within the industry, connecting dentistry to medicine. So when your physician says you are diagnosed with diabetes, we have that solution built. We just have to plug in the players. But we're the only people solving this problem, and I
Yeah.
believe it's the biggest. I think it's the biggest problem in dentistry.
Yeah. I mean, it's so funny because there's so many similarities between being in the world of like HR and dental. I feel like it's such a lonely place because nobody cares about it. Nobody wants to worry about it, and we're like, you guys, this is important. And I feel like this is a similar initiative where it's like, yeah, it's not the sexiest thing, but it's so important to protecting the practice, protecting the patients, making sure the care is ultimately up to standard, regardless of who they're seeing, as their provider. And I think that's such an important thing. And I do think that the messaging I'm hearing in our industry, they are behind that idea. They do want to always put that quality of care first. And this is a way that, while it might be forcing their hand because of this act that they have to do it, at least, the benefit is good regardless.
Well, Jill, right there, I think you mentioned that this is important, that it's not well known, and which I appreciate. But you also said it's not sexy, it's boring, and that it's going to make me lonely. So I don't know.
Maybe that's me
what
projecting of being in HR for 10 years, but
Yeah.
the compliance side, people are like, I don't want to talk about that. I want to talk about getting new patients. I want to talk about marketing. And I'm like, but what about the compliance?
Well, okay, let's take a step, because you're 100% correct, and we talk a lot about the regulation that not that nobody cares about it, but they're like, what's in it for me?
Right.
Right.
I don't understand.
Why? Well, how does this positively affect? Nobody wants to talk about fines, right? Well, how does this actually help? Now, like with HIPAA, it's, and I've talked about HIPAA for a long time. I've been on the privacy and security work group for the Minnesota Department of Health. It's a big part of what we did at Opera. Frankly, it's a big part of what we're doing at Toothapps, but it's hard to make a case that HIPAA is going to make you more efficient, make you more money, get you more new patients. Cures Act interoperability is the exact opposite. This is empowering you to leverage your data so that you can, on an organizational level, you can do whatever KPIs that you need because you have access to the information. Anybody that is a CFO, that's a COO is listening, is probably going, yeah, heck yeah, right? Because right now it's a PIA to get that done, or you have to like beg some computer software engineer to hopefully give you access, or some BS. This is not their data, it's yours. It's yours as the organization and the patients, right? So and then if you're a dentist, oh my gosh, just think of the amount of amount of efficiencies when you actually have the knowledge of what you should do versus not do. You'll get better outcomes in less time, way less like unnecessary radiographs and having people come back and doing testing because you're kind of treatment planning in the dark. Because if you think about revenue as what we're striving, where does revenue come from in a dental practice? It comes from treatment. Treatment that hopefully is successful, because if it's not successful and you have to do remakes, that's negative on your revenue. And treatment all comes from what? A diagnosis, right? Again, an accurate diagnosis. What do you need to have an accurate diagnosis that leads to positive treatment and revenue? You need to have information. You need to have the dental history, the medical history, the radiographs, the STL files, the CAD/CAM scans, the CBCT, the patient history, the dental history of that tooth. All of those things that's the base of the pyramid that ultimately leads up to a higher ROI. So whether you're a C-suite executive, you're a dentist or a regional manager, or you're the patient, everybody in the entire care sector, every stakeholder here benefits greatly from this. So while the details of the legislation and the sort of how we get to this point can be boring, can be what did you call it? Lonely, unsexy. Thanks for all that, Jill. The actual end result is the exact opposite. It makes everybody in the practices, including everybody in a support center, makes your job easier, makes you more money with less headaches and happier patients, which ultimately leads to the virtuous cycle of awesomeness, where patients are referring. They're going, oh my gosh, this DSO gets it. They have an application where I can get my data. I think patients go home. They have 3 treatment plans. You threw all this information at them. They have no idea what the hell to do with it, right? They can get home. They can go home. They can open up the application. They can look at it. They can message the team and say, oh, what was the difference between option A and option B? It's just opening up a whole new realm of revenue, of patient care, of reduced friction. And frankly, it's going to make it so that our team members can be freed up to do what they do best, which is treat people, not be stuck in the computer trying to do data entry and all the laborious, unsexy, boring, lonely work that you. that you mentioned, Jill?
Well, it's really funny because I always say, from again the HR for health perspective, I'm always talking about the wave of these newer generations, from the employment perspective, expect a similar experience as an employee as they are getting as a consumer. Meaning they can go on Amazon and they can order something very quickly. They know exactly when it's going to get to them. They know when the truck's down the street. They know when they have total transparency and visibility and ease of use. And so when that translates again on like just the employment side, it's like when you have paper, when you're asking them to like write on a Post-it note to change their time clock, like all of those things are so different than what they're experiencing as a consumer. They want to have a similar experience while they're working. And I think that from the patient perspective, that ties in absolutely as well, because it's like a patient wants ease of use. If they need these records, they want it to be super easy for them to be able to get them because they're experiencing that elsewhere with just their day-to-day life. And at the end of the day, the patients are the consumer here too. So it's, there has to be alignment from that, from like I have to think there's like a patient retention piece of that, because like, great, it not only makes it's easy when I'm there, but when I need to have information when I'm not there, I'm able to access it right away.
I totally agree. And you hit on a really great point that I like to talk to dentists about when they ask me about technology. There's a when to technology, right? Mm-hmm. And what do I mean by that? I mean that some technologies make sense to implement before other technologies. Mm-hmm. And I'm going to pick on you again by asking you a question that you don't know the answer to. So I apologize. Okay. But again, it's for the audience.
Love it.
At the end of 2022, what do you think was the technology that was number one on the list of dentists? What the technology that dentists were going to implement in their practice in 2023?
I'm going to say AI.
Great. That might be for 2024. Because there's been a big uptick in AI in 2023, right? So I think, so you're probably right what it's going to be for 2024. But I still stand by what the answer I would say is the exact same as what it was going from 22 to 23. 22 to 23, it was 3D printing. Okay, that's what the number one technology that dentists wanted to implement was. What you mentioned, Jill, which I love talking about, is if you're a human that's been walking around planet Earth in the year 2023, and you didn't know anything about dentistry, probably nothing about healthcare, and you were interacting with a dental practice for the first time, what would you expect that experience to be like? Would you expect them to have AI and 3D printing? No, is the answer. Would you expect them to be able to have access to your entire dental record? Absolutely, yes. Would you expect them to have a responsive website where you can make an appointment? Of course you would, right? And what's happened in dentistry is that we've not focused on the patient perspective to the point where we think a 3D printer is more important than our practice having a website, right? Being able to pay their bill online. Or what we're doing, I think, is foundational. And when I talk to leaders in DSOs, and they're like, well, we have a roadmap where we're doing like, we're thinking of putting in some AI, and then we're looking at doing some this or that. I'm like, why would you do anything before your systems can communicate to each other? Right?
You're just adding another system in to make it more complex.
You're just adding fuel to the chaos that you're already doing. Like we have a part of Toothapps is that's when you sign up for the platform, it's for free, just like our fully integrated calendar. We have a secure messaging platform. So if you're the CEO of a DSO, you can say to all the hygienists, hey, there's an emergency meeting on blood pressures. It's in your calendar for tomorrow, right? That type of communication from the hygienist sending a message to the dentist when they're ready for an exam, to when the COO has to send a message to all the specialists in the practice, or that's a key function of an organization that is brought all together by all these systems communicating. And so what is the value of that when you bring in, let's take yours, AI? Well, your AI will work so much better when all the other systems communicate, when it's in the calendar, when you can securely message these findings across your platform. So I can't remember exactly how you phrased it, but I talk about it that the timing of when you implement technology is important. Don't look at each technology in a vacuum.
Yeah.
What's the next one? You know,
Mhm.
picking out the coolest electric car when you don't have a driver's license doesn't matter, right?
Right. Yep.
Start off with the fundamentals. And right now in
Mhm.
dentistry, I think we've been ignoring it for way, way, way too long.
Yeah. Yeah. So, in terms of the platform, can you speak to what it looks like from the practices side of things and then also from the patient? Like, how does that work on both ends?
Yeah. So from the patient standpoint right now, we haven't released our patient app yet. That's coming out by the end of the year, right? So we are
You
actually
heard it
writing a
here first,
standard.
everyone.
What's that? Yeah, we're writing the standard right now. It
Yeah.
should be this, and the way these work is as you write the standard, we're building the technology that adheres
Yep.
to that standard, right?
Of course.
So that's why we don't have this. So I can't talk too much about the patient application because I don't want to misspeak, because this
Yeah.
will
Of course.
probably be memorialized, right?
Yeah.
But today, at the third quarter of 23, the patient application, when you log in, there's it's a platform. So on the right hand side, there's all the different applications that you use. If it's EagleSoft or the Teledentist or Planet HIPAA or all of our Toothapps Connect partners, we call them, similar to the Apple App Store, you have all your apps there, right?
Yep.
And then your main screen is whatever application you're looking at. If it's the Toothapps calendar, that's what you're seeing. If it's iCore Connect's prescription module or whatever, it's right there. And we have currently over 30 Toothapps Connect partners. And again, we're an open platform, so any platform can plug in, and we do interoperability. So for example, if you go to the Toothapps marketplace and you click on HR for Health, when you become a Toothapps Connect partner,
Yep.
your employees will be automatically enrolled, right? And then whatever training that HR for Health has, it auto populates in their calendar so that and then there'd be a little icon for HR for Health. If there's something specific in HR for Health, you just click on it. It opens up within that platform, or we can send you directly to that application separately, depending on the partner and what their desires are. So it works kind of like the App Store for Google, the App Store or the Google Play Store, the Apple App Store. The only difference is that our Toothapps Connect partners have the ability to leverage the calendar, the secure platforms, this messaging platform. So if you get a message through HR for Health, it can come through our platform, which is called Forum. We also have an AI product that just launched last week called Forum AI, where you can not just message your team members, not just message your laboratory. You can also securely invite anybody, so you can securely message your patients. We have an AI chat bot that you can ask questions to, like, how long does it take for a third molar to heal, or and that AI chatbot is trained specifically for dental team members. It's not for patients. So
Got it.
and for DSOs, we can train it on your standard procedures. So if you want to have people can ask, how much time do I get off for maternity leave? We can have it answer those questions based on your data for your organization.
Interesting. That's really cool. Oh my gosh, I'm like geeking out over this. This is
There's more to it, but it's hard to describe a platform that has multiple applications.
I totally get it.
On it, right? Yeah,
you did a pretty good job though.
Thanks.
So for right now, because the patient side is still being worked on launch, are the groups and practices that are using the platform, is that where they're going if they are being asked for patient records right now? That's where they're going to pull all of that together.
Yeah, I mean, right now, just frankly, it's hard because nobody's built it before.
Yeah.
So, I mean, you would have to pull it from separate systems. And frankly, a lot of systems you can't. Like, how are you going to give? I mean, how are you going to give patients the access to a CAD scan? I don't know the answer to that if you're not going to use Toothapps, because we have the answer that's coming in Toothapps by the end of the year, and there's all sorts of we have a 3D viewer already plugged into Toothapps, so there'll be a patient where they can actually look at their CT scans, their CAD CAM scans directly within the application, right? So we're building it. That's going to be available basically for free for patients by the end of the year, so they'll have access to all of that. And then the question is, does that CAD system plug into Toothapps so that we can then provide it on the patient? That's up to the software vendor. But again, it's not optional. It's this federal regulation that if they don't do it some way, they're out of violation. So hopefully, we're trying to be as open as we can so we can get as many platforms onboarded as possible. But it's up to the individual software vendor to actually provide the information.
Yeah.
So that's a long answer to your question. So sorry about that.
No, I mean, it's all very relevant. I think that what you're illustrating is really this spider web of all of the components that go into it. And I think that it's really awesome that you're kind of forging this path. And, again, while it might be lonely for a while because you're the one figuring it out, I think that everyone's going to be very grateful that you are starting on this journey, because I think if nobody was doing anything, it would be extremely stressful and these unnecessary fines would be happening that could be avoided, and nobody wants that on any end. So and again, to your point, it's contributing to revenue, it's making your patients happier and giving them that transparency. So it's checking all of those boxes. And I think that everyone that is utilizing it will probably see how quickly this is adapting as you're getting these different companies on board and in the platform and working through that process, because it's going to continue to evolve and new companies are going to pop up and those will have to get on the platform. So I have a feeling it's going to always be evolving.
Well, it's funny that you mentioned it being lonely, and that is what's interesting. And you've known me for a while. In fact, you said something about like a lot bouncing around in my head or something like that at the beginning of the podcast, right? Oftentimes, I've had many people say, Bryan, everyone says you're a smart guy, but nobody knows what the hell you do, right? And I would say that that's where I was with this about 2.5 years ago when we were going down this path. And I had a good friend of mine about a year ago, because I've been talking about this to those people that know me because I've been working on this for about 3 years. That were like, oh, they, smile and nod, right? And one of my friends about a year ago pulled me aside and said, Bryan, when you're talking about working on standards and interoperability and building this platform, I acted like I knew what you're talking about, but I didn't know what you were talking about. And then he said, "Oh, I get it now. Like now he gets it, right?" Yeah. And that's not. And what's happening is I'm hearing other leaders in the industry parrot messaging about the Cures Act, because this is coming. It's coming hard to the industry.
Yeah. And
it's no longer lonely. I mean, I'm on this podcast talking with you about it. We haven't talked for, I don't know, a decade or so, or 8 years, right? So we have been here in Toothapps. We've been sort of in our little nerddom, creating this platform, writing the standards, doing the work with the American Dental Association, with the other sort of people that geek out over data, right? And software vendors that are feeling the pain of not being able to do their great work on behalf of dentistry. And what's great now is that I kind of feel like, that there's a lot of spotlight being shined on this now. Mm-hmm. So while many people who are listening to this might be hearing about it for the first time, and that will continue on for the next decade, like you're saying,
they're going to keep hearing it.
Yeah, but it's going to become more and more and more, just like any sort of new phase that we enter. And I think we are entering a new phase of dentistry. And this is how I classify it. I call it dental 1.0, dental 2.0, and we're just at the cusp of dental 3.0. Dental 1.0 is analog. If you think of, high-speed handpieces, four-handed dentistry, analog delivery of care. Dentistry 2.0 is kind of how when I graduated out of dental school, it was like the first CAD CAM systems and CT scans and digital x-rays and digital charting. And now even the AI products that people think of when they think of AI, that's dentistry 2.0. Dentistry 3.0 is about interconnectedness, medical dental integration, teledentistry, remote care. Maybe I'd call it that rather than teledentistry, because a lot of people don't know what the value in teledentistry. So I'd say remote care. but interoperability, I think, is going to be leading that charge.
Mhm.
And we're in that early CERAC 1 phase of interconnected dentistry right now. And so everybody listening right now, you're hearing about this at the very, very front end of what I believe is going to be a multi-decade trend of interconnected dentistry. Does that make sense?
Yeah, absolutely. And I think one of the things that I am so excited about too is that you are participating in our speed network, our technology speed networking at our DSO Leadership Summit in 6 weeks in October. And this is exactly the reason why we have that speed networking, is so that the DSOs can learn about this up and coming technology that they might not be aware of, that is really going to change how their day-to-day functions. And so I'm super excited to have you a part of it. And this is, again, kind of a sneak preview, but to be able to showcase that at our event, because those are the people that need it. I mean, we haven't even really gotten into how this impacts growth plans and going into multiple practices and, multiplying the complexities of these systems. And so the groups really, I have to assume that this is going to be something very interesting to them, because they can't be in multiple places at once, and having all these systems across the board is making it really difficult when they are tasked with, again, trying to bring this data together and make sense of it.
Yeah, just if you think about communication alone, just that piece of it, communication between your team members, right? If you have a practice of 10, there's a lot of miscommunications that can happen. In fact, in healthcare, 1/3 of mistakes are due to miscommunication. But if you expand to 10 locations, 100 locations, it doesn't linearly become more complex. It exponentially becomes more complex, right? And so you're absolutely right. And, and I'm just honored to be part of the Tech Summit. And, I'm just, I just love what HR for Health is doing. And I just love what all you stand for what you're doing for DSOs. And so thank you very much for having me be part of it.
I have a couple fun questions before we wrap up. What shows are you binge watching right now?
Oh, right now I'm watching Good Omens. I'm not a binge watcher, but I have to admit I'm binge watching it. Yeah. So it's Neil Gaiman, who's like a comic book artist, and I was a comic book nerd as a kid, maybe a little more than a kid, and it's on Amazon. It's a great show.
On Amazon Prime. Okay, that's good to know.
Prime.
And what I always have to ask, what are you reading? What books should our audience know about?
Oh, I'm reading. I just finished a book that I wouldn't say it's written the best, but for me, it's like when you get the perfect book at the perfect time. It's called Buy Back Your Time by Dan Martell. It talks about my chief of staff. You might know Megan, my chief of staff, who's a total rock star, but she's on maternity leave and coming back in a couple of weeks. And it talks about, how to work with your assistant or chief of staff to do your email, and how to delegate things, and playbooks, and how to standard operating procedures, and some ideas there. So it's not, like I said, it's not the best written book, but some of the ideas, I certainly think it's worth a read. Buy Back Your Time.
Okay, good to know. So one final question for you before we wrap up. Again, I just want to highlight that Bryan is going to be at our DSO Summit. And, it's funny, Bryan, when you were like, people ask me what I do and they're not sure. If somebody asked me what you do, I would say he is the epitome of an entrepreneur. Like, it is just in your blood. And so that is really, the event is geared towards the entrepreneurial minded owners that want to grow their groups. And so I think that there's going to be so many synergies and connections. So again, I'm super excited to have you there in October. And I think everybody's going to learn a ton from you. So I appreciate the value that you're bringing there. And the final question I'll leave you with is, where do you see dentistry in 5 years from now?
5 years from now, I think I believe that the sort of early idea of medical dental integration will be just starting to take off. I think it's going to take about 5 years for it to really take off the way that people in dentistry want it to take off. But I think that's a piece that people are thinking about. I also believe that the way we think about AI in 18 months is going to be very different than the way people think about AI today. I think almost everything we do will be touched by it, but in different ways than people think about it today. I think it's going to be and one more thought, because I could probably talk about this where dentistry is going to be in 5 years for an hour and a half. So, but the other piece is I think that our challenges when it comes to finding, retaining, educating quality team members, the great work that you guys are doing at HR for Health is the key here, is going to force us to have more automation in many, many different ways so that people will not do things that people are bad at, meaning they won't be doing the mundane, laborious, I'm going to harp on this again, lonely things. They'll be treating people, which is what everybody in dentistry should be doing. They should be freed up to see people, and let's let automation, let's let AI do the things that people aren't good at so that our quality team members can be freed up to treat people, which is what we're wired to do, right?
Yeah, I could not agree more. I mean, I so enjoyed this conversation, Bryan. I learned a ton, and I'm so excited again for October to be able to kind of continue to help with speaking with the DSOs about this, because these groups are seen as kind of leaders in this space of trying out these new innovative ideas. And I think that if anyone is bought into AI or 3D printing or any of that, then they are totally bought into this, because it's so important. So I really, really appreciate your time. I know our audience does too. I'll see you in October. I cannot wait. And for everybody listening, we'll see you at our summit. And we look forward to it.
Thank you very much, and look forward to seeing everybody
Thanks,
at the DSO
Bryan.
Summit. Thank you.
Okay.